Good afternoon, everyone, and thank you for joining us today. Before we begin, I would like to note that the views expressed in written conference materials or publications and by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsements by the U.S. government. Next slide, please. Next slide again. My name is Mackenzie Simmons, and I have the privilege of serving as the project manager for SAMHSA's 988 Crisis Systems Response Training and Technical Assistance Center that's operated by Altarum. Next slide, please. The goal of the Crisis Systems Response TTAC is to support a crisis care system that is integrated, sustainable, equitable, and aligned around evidence-based and evidence-informed practices. Next slide, please. Today's webinar is the first session of 6 in a series of webinars called Connecting to Serve, Promising Practices for 988 and 911 Collaboration. This first session focuses on the foundation of 988 and 911 collaboration and aims to provide further understanding for why collaboration between 988 and 911 is important and necessary for jurisdictions to take on, to help further analyze 988 and 911 approaches that may work within your communities, and to assist in identifying solutions to barriers currently hindering 988 and 911 collaboration. Now let's take a moment to ensure that everyone in the audience is ready and comfortable with the technical aspects of this webinar. I'll now turn this over to my colleague Kaylee to walk you through the webinar interface, including how to submit questions and other technical information.
Thank you, Mackenzie. As you will see, closed captioning is enabled for today's webinar, but if that is not popping up for you, please go to your control panel and click closed captioning, and that will go across the bottom of your screen. We also have American Sign Language capabilities today. If you need tech support during today's webinar, please send me a chat message and I will address it for you. Lastly, if you have any questions during the presentation, please enter them into the Q&A chat function, and this will be sent directly to the hosts, the panelists, and the presenters today. Also, please note we will be monitoring the chat for any questions, but if there are any technical questions that I can help you with today, please send them directly to me.
Thank you, Kaylee. Next slide, please. Before we start our presentation portion, I'd like to introduce Tiffany Russell. Tiffany serves as the Chief of Crisis and Justice Initiatives with SAMHSA's 988 and Behavioral Health Crisis Coordinating Office, is an advisor to the 988 Director and other members of SAMHSA's senior leadership in planning and determining policy, programs, and activities that address complex challenges in coordination of 988 crisis centers with law enforcement, 911 call centers, and emergency medical service providers. She also develops, recommends, and implements programs and provisions of guidance related to improving crisis response and equitable access to services for individuals with behavioral health needs that minimize unnecessary law enforcement involvement and promotes diversion from the justice system. At this time, I will hand things over to her for a brief welcome and to introduce our guest speakers.
Thanks so much, Mackenzie. Good afternoon, everyone. We are so excited to have you join us today and are thrilled to have your participation. This webinar series is the product of a year of planning done by SAMHSA's 988 and Behavioral Health Crisis Coordinating Office. Before we move forward, I want to take the time to thank our esteemed leader of SAMHSA, Assistant Secretary Dr. Miriam Delphin-Rittman, and her executive team for their support of this initiative and the 988 office. Speaking of the 988 office, this webinar would not have come to fruition without the guidance and unwavering support of Director Monica Johnson, Deputy Director John Palmieri, Division Directors James Wright and Jill Mays, and Senior Advisor, also known as the Godfather of 988, Dr. Richard McKeon, as well as each and every member of the 988 team. I also want to thank the National 911 Office, as well as Vibrant Emotional Health for their partnership in developing this series. As the federal lead organization of the 988 Suicide and Crisis Lifeline, as well as Behavioral Health Crisis Services Transformation, it is our mission to ensure that every person has someone to call, someone to respond, and a safe place for help when experiencing a behavioral health crisis. The office is working tirelessly to provide support, guidance, and technical assistance to states, jurisdictions, and territories to ensure that people across the United States have access to crisis care when they need it at their most vulnerable time. This webinar series is just the first of many opportunities to engage with the 988 team and the Crisis Response Training and Technical Assistance Center. More information on how to access those opportunities will be provided by Mackenzie and the team later in this session. Now let's get to the reason of why we're here today. I am joined by 3 subject matter experts within the field, and we'll take a moment to introduce them to you now. Chan Neither currently serves as the director of SAMHSA's Gaines Center for Behavioral Health and Justice Transformation, where he oversees all training and technical assistance activities. He is also a senior director at Policy Research Associates, where he oversees a portfolio of criminal justice and behavioral health focused training and technical assistance initiatives. Our second presenter is Aloka Narayanan, who currently serves as a project leader at the Harvard Kennedy School Government Performance Lab, where she provides technical assistance to governments implementing unharmed alternatives to police. She has worked with cities across the country to substantively increase the scope of unarmed response programs through 911, manage technical implementation, and implement data-driven approaches to identify community needs. Our last speaker, Adam Wasserman, currently serves as the Washington State 911 Coordinator, where he is responsible for coordinating and facilitating the implementation and operation of 911 emergency communications throughout the state. Washington State is rapidly moving forward to next generation 911 and recently transitioned to a new emergency services IP network that will enable statewide next generation 911 capability. Adam also currently serves on the executive board of the National Association of State 911 Administrators and is a member of the Crisis Response Improvement Strategy Committee responsible for statewide implementation of 988. With that, I will pass things over to Chan to get us started.
Great. Thank you so much, Tiffany. I appreciate that introduction and very much appreciate the opportunity to be part of today's webinar. As Tiffany shared, my name is Chan Neither, and I am director of SAMHSA's Gaines Center. Next slide, please. I know many of you or some of you may not be familiar with the Gaines Center, so I'll just give you a very brief overview. We are a federal technical assistance center funded by SAMHSA, operated by Policy Research Associates, which is the company I work for. And we've been funded by SAMHSA continuously for almost 30 years now to provide technical assistance to the field on issues related to the intersection of the criminal justice system and people with serious mental illness, substance use disorders, co-occurring disorders. We work very closely with states, systems, and the people who work within those states and systems on a whole variety of issues related to the intersection of those two broad topics. And we use a lot of different strategies to support systems change at the state and local levels, federal level as well. Next slide, please. We also use many different technical assistance modalities to help facilitate that systems change. This slide presents just a sampling of what we do, and if you're interested in any or all of the work that we do, you can feel free to visit our webpage. The link is at the bottom of my slides and sign up for our newsletter. But I want to highlight the last bullet, Policy Academies, which is highlighted, because that's what I'm here to talk with you about today, one of the Policy Academies that we did with our Gaines Center funding. Next slide, please. So to get us started, I want to give an overview of some different considerations and things that I think are a good primer for the discussion today regarding 988 and 911 and the intersection, collaboration, coordination between the two broad systems. Next slide, please. So how is 988 different from 911 at its most basic? Well, I think we probably all know by now that the 988 Lifeline was officially launched in July of last year, and that it was primarily established to improve or increase access to crisis services in a way that meets our unfortunate country's growing suicide and mental health crisis care needs. 988 was designed to provide easier access to the Lifeline network than its predecessors. And it's really, in terms of how it, very basically, how is it different from 911, is the 911 system or the public safety answering points, the primary purpose of those systems are for public safety. So the focus of 911 is really on dispatching emergency medical services, fire, police, other first responders as needed. Next slide, please. But they are complementary to one another. So how do they complement one another? Well, in order to ensure that for people who are experiencing crisis, who actually need to be connected with first responders locally through the 911 system, is those efforts need to be closely coordinated and allow for the seamless referral of callers to the appropriate care or response that addresses their unique circumstances. So the approach to the 988 Lifeline is really a very person-centered, individualized approach, and one that is designed to reduce unnecessary referrals to the 911 system. As Tiffany shared, as we all know, SAMHSA has been the leader in the rollout of the Lifeline and continues to be actively engaged with 911 counterparts like my co-presenter from Washington State at the federal, state, and local levels to continue to support coordination between these efforts and ensure more seamless coordination between the two. Next slide, please. So one question that gets asked or concern that some people have are, if I call the Lifeline, am I going to be connected with 911 or police going to respond? We know that a very small percentage of Lifeline calls actually require activation of the 911 system. And that primarily occurs when people who are, the caller is determined to be at imminent risk that there is imminent risk to someone's life that can't be reduced during the Lifeline call. Next slide, please. So what is imminent risk? Well, in the context of suicide, it's an imminent and impeding threat of a person causing substantial physical injury to self. Our 988 Lifeline staff are extensively trained in both the assessment and management of suicide risk. And in determining suicide risk, crisis line counselors routinely assess an individual's desire and intent to die, as well as their capability to carry through with a plan, an identified plan, and the immediacy of the time frame of that plan. So determining the imminent risk for a caller to engage in suicide behavior and the need for emergency intervention is probably one of the most significant judgments that a Lifeline Crisis Center counselor has to make. Next slide, please. So we know in terms of, how many callers then are at imminent risk, what's the frequency of which this issue, this need to coordinate with 911 exists. Well, we know that out of the total number of Lifeline callers, 23%, so approximately a quarter of those are currently suicidal. But the percentage of those at imminent risk is typically only around 2%, 2 to 2.5%. And of those who are judged to be at imminent risk, about half of those require emergency intervention. So about 1% of the total number of callers actually require some sort of emergency intervention. And the majority of those emergency interventions are people whose suicide attempts are in progress. So it's really those 1 to 2% of callers where the collaboration between the two systems really comes into play. Next slide, please. So as I mentioned before, and I think we all know, the primary goal of the Lifeline is to provide person-centered support for people in suicidal crisis, mental health distress when they most need it. As we've already reviewed, the majority of those seeking help from the Lifeline don't require any additional interventions at the moment. and that fewer than 2% actually require some sort of connection to emergency services like 911. So we know that there is a very small percentage of callers and issues that do warrant a response or may warrant a response from a first responder. And that the 988 coordinated response in those cases is intended to promote stabilization, but also for all callers is intended to promote care in the least restrictive manner. Next slide, please. So in terms of the role of collaboration and coordination between the 988 and public safety answering point, PSAP, or 911 systems at the local level, the intent is really to provide connections to the localized responses that are needed for the caller who's in crisis. And that, of course, includes response by public safety entities. But the goal really, and in terms of, when we look at an ideal crisis care system, the goal of making that connection is to do so in the most judicious and evidence-informed way to support and avoid unnecessary involvement with law enforcement. Next slide, please. And so why do we want to avoid? Well, I mean, there's obvious reasons we want to minimize the use of our law enforcement officers. But one of the reasons is because when we rely on or have as one or the only response option in a community, response by a law enforcement officer or entity, that the cost to the justice system and to the law enforcement agency in particular is disproportionately high when used in that way. And then particularly when that they're the only response option, and exacerbated often in communities is the fact that there don't exist resources to support people in crisis. So in other words, where does a law enforcement take a person who's in crisis? If there's no other option, our local hospital emergency departments are often the only option for law enforcement, which just can exacerbate and add on to the burden that law enforcement resources face when responding to people in crisis. So real-time coordination by 988 Lifeline centers and local response options really emerge as one of the core options of a well-functioning crisis system. Being able to have appropriate and alternative to law enforcement response options available, as well as options for continuing care, both acute and ongoing care for a person experiencing crisis. Next slide, please. So we know that the 988 Lifeline call centers are charged with ensuring real-time quality coordination of crisis care. So within that charge, collaborating in those instances where warranted with 911 and PSAPs is essential. The other sort of essential component of that is the capacity to share information between the two entities, managing the flow of that information, and having systems that can help keep track of people both in the moment in terms of the immediate needs, but also on an ongoing basis. And we're going to talk about a little bit about some of the data sharing, data collection, data management types of issues that some of the states encountered during their work with us in the Policy Academy. Next slide, please. So I'm sharing this next slide. I don't have time to go over it, but I think it's a great slide, and I know you all will have access to the slides afterwards, so I encourage you to review this on your own time. But it is a chart that was presented as part of a presentation at our Policy Academy meeting a little over a year ago by Rachel Ware, who's an attorney with the Federal Communications Commission. So I wanted to share that slide so you would have that for your records, but we're going to go ahead and move on in the interest of time since I'm about halfway through already. And I want to talk about the Policy Academy that I keep referring to. So if you go to the next slide. So we routinely conduct policy academies through the Gaines Center on a variety of topics that are germane to the intersection of the behavioral health and criminal justice systems. So we were asked by SAMHSA to coordinate a virtual policy academy the year before last. It culminated about a year ago to help support the national rollout of the 988 Lifeline. And the goal or the focus was really to ensure successful coordination between those two entities through the development of guidance and local implementation strategies to support statewide rollout efforts. Next slide, please. The Policy Academy is really a process. It's not just a meeting. The meeting that we have with teams is a very important part of that process. But we work with teams who have signed on to participate to do extensive preparatory work leading up to the development and continued refinement of strategic action plans. So we spent quite a bit of time with Policy Academy teams doing that prep work. We hosted a series of local / statewide stakeholder meetings I mean, I think those of, everybody I think on the call is probably pretty familiar with all of the different roles, agencies, people, state, local, there's a lot of people and a lot of different roles involved in this, broad, what does it mean to collaborate between the Lifeline and local 911. So a series of stakeholder meetings within each of the states to really make sure that we were getting the perspectives of everyone who needed to be included. And then providing a substantial amount of technical assistance and support leading up to the Policy Academy meeting to help inform the development of priority setting and then the development of a strategic action plan to address those priorities. So I'm going to talk a little bit about then what did we find generally working with the states. So if we go to the next slide, the 5 states that participated in the Policy Academy were California, Colorado, Georgia, Maine, and Minnesota. Next slide, please. And what did we learn from the states? Well, if we go to the next slide, where we started with the states, and I would imagine that most people on the call are familiar with these 2 resources. SAMHSA, in support of the launch of the Lifeline last July, developed with the assistance of the National Association of State Mental Health Program Directors, or NASHPD, 4 sets of playbooks that examine different aspects or different roles within the rollout of 988 at the state level. And 2 of the playbooks were very specifically focused on the 2 groups that were part of this Policy Academy. So a playbook for the PSAPs 911 and a playbook for the Lifeline contact centers. And in those playbooks, there were topics and issues and strategies that were discussed that states and the entities who are involved in this should be taking into account and using to help inform and develop their approaches to a whole variety of aspects of this broad, task of implementing 988 and coordinating with 911. So we use that information to provide a framework that would help states narrow down as part of the Policy Academy process, so their participation in the Policy Academy, what were some of the issues that with SAMHSA's support of the Gain Center, they wanted to focus on. So we by no means addressed every issue comprehensively as part of this process, but really focused on what were the things that could be most useful in the work that we had to do with those states. So that was the structure, if I get the next slide. So using that information, we engaged in a SWOT analysis with each of the state teams to really get at what were some of the strengths that the state teams brought? Where were they particularly strong? Where were there some of the weaknesses? What were some of the opportunities for leveraging resources, developing partnerships, et cetera? And what were some of the things that might impede some of the progress that could be used to help inform these strategic plans? Next slide, please. So we found some common priorities across the states when examining the state strategic action plans. One of the most important priorities that emerged from across the states was the need to develop and implement and refine standardized assessment instruments, standardized call handling and referral protocols between or across the Lifeline centers and the public safety answering points, or 911. Those were, I know a lot of progress has been made since we were able to work with these teams on some of those issues, because they were critical in terms of going back to what we talked about before, in terms of Lifeline counselors really understanding how to assess for imminent risk of suicide, and then what to do with that information, how to make those connections. And then at the local level with the PSAP or 911, knowing what resources were available, how response should be dispatched, and what was appropriate for different situations for different callers who were indeed referred to the 911 system. Another common priority was developing and implementing standardized training and education, along with workforce development and workforce development initiatives for staff across the 911 and 988 continuums. So there was a lot of education that needed to be done on both ends in terms of understanding one system function and the other system understanding the same about the other. So a lot of training being developed and recognized need for training and resources to provide that training to staff across the continuums. Data and information sharing. So establishing and implementing policies and procedures for data collection, information sharing, determining what types of data were available from what agencies, what should be collected, what should be shared, how should it be shared, making sure that the either the technology was there and accessible or what technology was needed to enable that kind of the necessary information sharing between the two continuums, and securing agreements about what data, who could access what data could be shared, the protocols for doing that, and entering into agreements to really support and enable that data sharing. And then broadly increasing collaboration between entities across those two continuums. So those were kind of the four overarching common priorities across the states. Next slide, please. This next slide represents specific priorities within each of the state action plans. And you can see the common priorities reflected there. And then there were also some states that shared common priorities as well. For instance, a couple of the states had a very concerted focus on interfacing with tribal organizations, tribal law enforcement, and just generally their services and systems that serve tribal populations. A couple of the states had a focus on addressing rural issues for sure, and some of the issues that are presented in our rural communities. And one of the features that was, I think, particularly good about the Policy Academy process was that each of our states that participated had were doing excellent, exemplary work in certain areas. So there was a lot of peer-to-peer sharing among the teams learning from one another in terms of, you know, Maine is doing this particularly well, or California is doing this particularly well, and how can we learn from that as a state for the work that we're doing? I know California had as a goal coming into the Policy Academy to be a national example for the country, and I know they've been doing a lot of work in that regard. So I'll, again, you know, don't really have time to go through all these priorities, but I think this summary chart will give you sort of a sense of some of the work that the teams have been doing. We stopped working actively with these teams at the end of the Policy Academy, which is the end of last year, so about a year ago. And if we have any folks from any of those teams who are on the call, I encourage you to share anything you want to share about the continued work that you did. If there are resources or other things that you want to share in the chat with the folks, rest of the folks on the webinar, that would be fantastic if you did that. I appreciate it if you do. So the next 5 slides, if we could just kind of go through those very quickly. These are 1 slide per state team where I just wanted to provide these, again, knowing that you all have a slide deck to refer to after the webinar that provides us a little bit more of a detailed summary, team by team or state by state. We can just kind of continue to go through those 5 state slides. And you can take a look at those at your convenience. We don't have time to review that today. But if we can continue to advance through those state slides, and then we can get to the last slide here, the takeaway slide. So just a couple of takeaways as I wrap up my time here. The first 2 bullets here really correspond to those pictures. And I encourage you, if you haven't reviewed either of these sets of resources, to do so, because even though some of the content, a lot of the content was focused on supporting the rollout and the initial implementation, there's so much good information in there that continues to guide the ongoing implementation and enhancement efforts. And a lot of the takeaways in terms of our work with the teams, it was focused on the importance of that continued collaboration between the state and local levels, and the local planning groups, local stakeholders, and champions, both at the state and local levels, to continue the coordination and collaborative efforts between the two systems. That data collection piece we talked about, the need to really understand what response options are out there, what's law enforcement's role typically at the local level, at the state level, and map resources and services that are available to assist people who are in acute crisis, who do need follow-up services in the community. Benchmarking state and local programs, and as we've talked about, training, workforce development, triage protocols, are all really key takeaways that I know a lot of states are still continuing to refine and continuing to work on. And if I could have the next slide. This is my contact information, the contact information for the center. If you want to sign up for a newsletter, you can go right to our webpage on the SAMHSA website. And if you want to be connected with any of the state team leads from the Policy Academy, if there's things that you see that you're interested in, feel free to reach out directly to me, and I'd be happy to make those connections offline for you to some or all of the team leads from those state policy academies. And if we could just get the last slides, I just want to acknowledge the contributors to my slides. And I thank you all very much for your time, and I'll turn it over to the next presenter.
Thank you so much, Chan. That was such an awesome presentation. I know I learned so much, so I'm sure that other folks on the call also found it super helpful. Hi all, my name is Aloka Narayanan, and I'm a project leader at the Harvard Kennedy School's Government Performance Lab. And I'm incredibly glad to be here among so many esteemed speakers to share some learnings on 911-988 collaboration from a local government perspective from some of our work in alternative 911 emergency response. Could I have the next slide, please? Thank you. So the Government Performance Lab is an applied research and technical assistance organization that is based out of the Harvard Kennedy School. And we focus our technical assistance on 5 policy areas in particular. We work in the areas of homelessness and housing, in children and families, economic mobility, procurement systems, and criminal justice. And through our work, we support jurisdictions in building just and effective service systems in 4 key ways that you see on this slide. The first I'll highlight is that we provide intensive technical assistance to state and local governments through more than 75 staff members all across the nation. And our technical assistance is largely focused on diagnosing challenges, piloting new projects, and implementing alongside government staff for a short or longer term, depending on their needs. With our government collaborators, we execute high impact projects where we test new solutions. For example, some of our recent projects have focused on identifying pathways to housing for formerly incarcerated folks and preventing child welfare system involvement by connecting families to community resources. Through our testing of these innovative projects, we're consistently also pulling up on information to identify where we can spread our solutions and our learnings in a way that is most accessible to a wide audience. So as an applied research organization, we're informing the field as we perform our projects. We develop and spread solutions nationwide through a variety of means, including an alternative 911 emergency response community of practice, which I'll share a little bit more about in a second, and other groups available to government staff. Our team also gives presentations at conferences and webinars and puts out research in the forms of briefs, memos, and other publications that are available on our website. And I can share those that information in some follow-up communication with you all about how to engage with some of our work as well. The last but not least that I'd love to highlight on this slide is that we work alongside government collaborators, not only to pilot these innovative projects, but also to train up on helpful skills to ensure sustainability of these projects. Through our implementation, we often see many unsung heroes among our collaborators who, with just a little bit more time or training on something like data-driven performance management, for example, could pull off transformative new projects. This area of focus is something that we're particularly proud of. Can we go to the next slide, please? So today I want to focus a little bit of my conversation with you all on alternative 911 emergency response, which is a specific lens to come with to the 911-988 collaboration discussion. In 2020, as I'm sure many folks on this call are aware of, starting with a fervent national call to action, governments began exploring ways to reduce unnecessary criminal justice involvement for community residents. And this led to a growth of programs to divert 911 calls away from law enforcement and towards more appropriate resources. The Government Performance Lab began assisting Harris County, Texas in 2020, where Houston is located, and 4 more governments through a pro bono implementation cohort in 2021. Each government was focused on the challenge of historic over-reliance on police to resolve calls that fell outside their express specialty. Governments across the nation, including these governments that we worked with, used this opportunity to consider innovative ways to address resident needs. We've heard folks use the phrases right response at the right time or appropriate use of resources to describe what they wanted to create to better serve their people and free up needed resources to address incidents in the community. Alternative 911 emergency response programs do exactly that. The GPL, or the Government Performance Lab, defines alternative response as unarmed emergency response teams that can be directly dispatched to 911 calls. These teams often are comprised of trained responders like social workers, peer support specialists, and EMTs. So the GPL is focused right now on supporting jurisdictions that are testing and demonstrating methods of developing, improving, and expanding alternative response programs. And these efforts, I want to acknowledge, are built on existing mobile crisis outreach that have been present in communities across the country for years. We're just giving it a new life through a new pathway through 911 and often through diverting to lines like 988 to be able to dispatch these teams. Next slide, please. The Government Performance Lab, through our Alternative 911 Emergency Response Initiative, is currently providing pro bono support to 15 jurisdictions through our implementation cohort, where folks have access to share learnings and brainstorm with their peers on alternative response initiatives. In addition to supporting an implementation cohort, we also share learnings about the field with 70 plus governments through a free and open community of practice, which I'll touch on in a moment. Through our implementation cohort, the GPL provides research and implementation assistance that fit the needs of each jurisdiction, and specific areas of support can include things like analyzing 911 call data and designing call decision trees, creating training curricula for response teams and 911 staff, and policies and procedures for when to transfer calls to 988. The 15 jurisdictions that we're working with currently are listed on the right-hand side of this slide. These are all of our current cohort members. And some of these members currently divert calls from 911 to 988 to dispatch alternative response teams, or are actively exploring this option. While each government that we work with has some variation in their specific challenges and program design, which is why we provide tailored support, you'll notice that some of these jurisdictions have quite a bit in common. Whereas some of them are largely urban and others have a rural or suburban regions mixed in, you'll also see some shared needs despite these differences. And some of these shared needs are in this pink call-out box here. 911 and 988 collaboration is a key highlight of some of those shared needs. We see that many of the governments that we work with are still trying to work through some kinks in how they collaborate between the two systems. Before I move on from this slide, I just want to highlight some opportunities to engage with some of our work. One way that you can learn a little bit more about our work is through our website. We can share some materials in follow-up to this webinar about that. But you're also open to, as government staff, register for that community of practice that I noted in our alternative response initiative. This community of practice is available to governments exploring or running alternative response initiatives, and we meet monthly. And this month actually featured some information on dispatch protocols and training from a particular government in the Southern California region. We may also have some opportunities in the future to apply for pro bono support through our implementation cohort, so happy to stay connected with folks. My email address was also on the first slide of this presentation, so happy to be in contact with folks afterwards through that venue as well. Can we go to the next slide, please? So I want to focus in now on the specific things that we're learning about 911 and 988 collaboration from my implementation work and my colleagues' implementation work with alternative response programs. So here's what we're learning so far. As folks in the audience are well aware, 911 centers all over the country are facing staffing challenges and long call waiting times and other areas of priority challenges. 988 call centers are managing the mandate to be up and running in a short time and make sure they're aware of all of the resources that are available in every community that they cover. Often, integration and collaboration between the two can fall on the back burner when other pressing challenges related to providing timely assistance or services to community members are taking precedence. We're seeing a lot of leaders have the desire to connect and regularly interface with their counterparts in each center. And I think Chan's presentation also highlighted that. But these folks have limited time to do so, just given other demands on their time. A second learning that I want to highlight for folks is that as a result of this deprioritized collaboration, what we're seeing is that 911 and 988 telecommunicators may not fully understand what each is trained to do and what information that they are meant to collect. Essentially, they're speaking different languages. Through discussions with some 911 telecommunicators, we've heard that they're just not sure what 988 telecommunicators are skilled up to do. Can they de-escalate calls? Can they manage crisis situations in the same way that 911 is trained to do? These are questions that we often hear. I spoke to a 911 call center staff member earlier this week, and she expressed worry to me that when she sends a call to 988, she doesn't know exactly what happens next. She doesn't know how long it takes for them to identify a resource, what number of calls is successfully resolved, nor what the 988 staff member talks through with the caller on the phone. This limited knowledge leads to skepticism and more tangibly low call transfers to 988, even if the situation could benefit from a call transferred from 911 to 988. So this call information and training information feedback loop is something that that seems to be an area of shared learning that folks can focus on a little bit more. In situations where 911 and 988 are regularly interfacing, or 988 is dispatching unarmed teams through 911 diversion, we still see some challenges around technology compatibility. To maintain team safety, unarmed teams will often have policies and procedures in place for calling back in for law enforcement support. But when they're dispatched via 988 and law enforcement is dispatched through 911, they might have to call back into 911 rather than being directly connected with a dispatcher that can quickly send a law enforcement team. Additionally, 911 may have no way to track the location of the unarmed response team if they're dispatched through 988, unless they call in and let them know. We've heard from some jurisdictions that ideally they'd be able to track the location of the teams, if not have regular radio communication with the teams to ensure on-scene safety. But that limited compatibility between the technologies, including computer-aided dispatch systems, makes that really difficult. Some of these learnings are things that folks are already focused on trying to address and are starting conversations across 911 and 988 centers to begin this. But just want to acknowledge that these are things that people are wrestling with, and for folks in the room that are seeing the same things, to validate that it's totally okay. We're all kind of on this path together. So just want to note that these are areas of focus that we're learning about and are hoping that we'll see some more strategies to address these in the future. With that, I'll turn it over to Adam Wasserman for the next portion of this presentation. Thanks.
Thank you, Aloka. Good morning. My name is Adam Wasserman, and I am the Washington State 911 Coordinator. I want to give you a perspective today of how 911 and 988 collaboration is working from our 911 point of view here in the state of Washington, why we think it's so important, and some of the challenges that we have faced. First, a quick background. Back in May of 2021, our governor signed into law House Bill 1477, a bill to implement 988. But the bill didn't stop there. It also asked us to enhance and expand the behavioral health crisis response system here in the state. This was a big step, And in addition to setting in place a funding source for 988, it spoke to crisis response teams, 24-hour follow-up, and much, much more. To the credit of some key legislators here in Washington, 911 was identified early on as an important player in the whole process, and they made sure that we were brought in from the beginning as a key collaborating partner. Next slide, please. So why is 911, 988 collaboration so important? I can't tell you how many times that I was approached by all sorts of different entities with the question, why is the 911 coordinator spending so much time on 988 issues? My answer was simple. We're married now. For better or worse, 911 and 988 are now forever linked together as partners in the greater crisis response system. One of our fundamental doctrines here in Washington is no wrong door. And the only way to achieve this is to have one and only one crisis response system. Yes, there are different ways to access that system, but there is only one crisis response system. And so if 988 fails, the system fails, and then 911 fails as well. Early on in the process, when we were just starting to look at how this new 988 would function, everyone wanted to know, how many crisis calls does 911 take? Of course, my first response was, define crisis for me. Crisis, like beauty, is in the eye of the beholder. 911 has been taking crisis calls since our inception and will continue because the person calling is having, in their perspective, a crisis, whether someone else would classify it as a crisis or not. So as we begin to operationalize this no wrong door crisis response system, we found that there are a lot more layers and a lot more partners that are dealing with crisis and need to be brought on the team. Entities like 211, regional crisis lines, community crisis hubs, first responders, nonprofit, and other helplines all need to be brought on the team. Next slide, please. So let's talk about some of those partners and stakeholders. Of course, you have the 911, the PSAPs, and the 988 hubs. But another key partner we identified was 211. 211 in the state of Washington is a key element to our crisis response system. They have numerous contacts and an impressive access to resources and follow-on support. Regional crisis lines as well have been around for decades in Washington and have been dealing with the same type of crisis calls. First responders also need to be at the table as part of the crisis response system. Often law enforcement is the first contact for someone needing to enter into the crisis response system, and it is vital that they are included in the process from the beginning. One of the biggest mistakes that I have seen throughout the process is when law enforcement is left out. We understand that many situations don't need and can even be more challenging with the presence of law enforcement, but if you truly care about everyone having access to the crisis response system, you need law enforcement in the planning stages and not just as an afterthought. In addition to partners, there are also key stakeholders. Again, the obvious ones, your departments of health, healthcare authority, Department of Health Services, local health jurisdictions, but don't forget the importance of legislators at the federal, state, and local level as part of this process. Next slide, please. So how are we collaborating? We look at our collaboration with 988 from 911 from three distinct levels. On a strategic high-up level, we are collaborating on a coordinated vision, one crisis response system with no wrong door. And we have to be messaging this with our respective communities and elected officials. When I'm speaking at 911 conferences, I'm continually pressing that message of one team, one fight, so that it spreads throughout the 911 community and they understand the vision and why it is so important. An admiral I once worked for said, "What interests my boss fascinates me." As leaders, it is imperative to understand our impact and not only talk about vision and what is important, but to walk it as well. Let them see you attend 988 meetings or speak on webinars like this. It is also important at the strategic level when legislation comes up that 988, 911, and in our case 211, are showing a united front for the crisis response system. There should be no cracks between us and our messaging. And of course, there needs to be collaboration with respect to funding. As another person I worked for once mentioned during a budget crisis, now is not the time to begin looking at each other like food. We need to collaborate and show that just like if 988 fails and 911 fails, also if 911 gets resources and funding, that helps 911 as well. The next level of collaboration is at the operational level. If we truly are one crisis response system, then we need to, at a minimum, understand each other's operations and to start bringing them closer together. One of the ways we're doing that here in Washington is through 2 988-911 co-location pilot projects, where we're placing some 988 crisis counselors into 2 of our larger PSAPs. The objective is that the 988 counselors will be able to listen in on 911 calls and monitor CAD, computer-aided dispatch, for opportunities to move some of those calls that would be better handled by 988. In addition to 988 and 911 getting to know each other's operations better, we also hope to collect data to inform how we will move calls back and forth between the 2 systems in the future. And finally, possibly the most important level of coordination, at least for the person in crisis, is the tactical level. This is where the 988 and 911 telecommunicators who actually handle the calls can collaborate on process and procedures, what information is needed when transferring calls back and forth. And the best way we found to do this was to get groups of 988 crisis counselors and 911 telecommunicators into a room together to figure it out. They're the experts. They're the ones doing the work, and they know best how to run the system. They don't need people like me or other staffers trying to figure this out for them and getting it wrong most of the time. And on a final note, like any good team, we need to train together if we want the whole system to succeed. Next slide, please. So as we have been collaborating with 988, what have been some of the challenges we faced? First off, risk and liability. Protection for our telecommunicators and the system as a whole is critical to get the job done. We were very lucky to have our legislators place liability protection for 988 and 911 call transfers into a recent bill which was passed in the last legislative session. This allows both systems the comfort that is much needed. Probably the biggest challenge that we have faced, and I know my counterparts in other states have faced, are egos and stovepipes. Looking at 988 and 911 as part of the same crisis response system is a new concept, and we are getting into each other's swim lanes in some areas. I didn't realize how territorial people can get and how defensive I could get when it came to 911. So when I mentioned that egos are an obstacle, I placed myself in that same group, and it's something we need to fix. And the best way to overcome those obstacles is to get to know each other. If you are leading a 988 system in your state, you need to go find your state 911 coordinator, sit down and get a cup of coffee, or even better, in front of a whiteboard. 911 coordinators, go conduct a sit-along in a 988 crisis center and actually see what they do. As I mentioned before, when we got a group of 988 crisis counselors and 911 telecommunicators together to discuss procedures, I had a PSAP director with over 30 years of service tell me I didn't realize all that the 988 suicide hotline call takers had to deal with. A mutual respect and, might I say, camaraderie ensued. We need to do the same thing at the coordinator and state agency level. Thank you for allowing me to speak today. I hope that I was able to shed a little bit of light on how we're doing things here in Washington and maybe provide a tidbit or two. I think we're taking questions after this. But I would like to say, don't hesitate to reach out to me if you have questions or would like to talk more on this subject. Thank you.
Thank you so much to Adam, Aloka, and Chan, our speakers. We really appreciate you taking the time to show your support and share your expertise with the 988 and crisis systems community.